Hello. Welcome to Module 3. In today's lesson, we will learn more about risk factors of cervical cancer. A risk factor is anything that increases one's chances of developing cancer. Although risk factors often influence the development of cancer, most do not directly cause cancer. Please consult your doctor to make more informed health-related choices. Let's discuss all the possible factors that may raise the risk of developing cervical cancer. The most important risk factor for cervical cancer is HPV. HPV is a common infection. Out of 100 different types of HPV, the most frequently associated with cervical cancer is HPV-16 and HPV-18. Uptake of HPV vaccines prevent the spread of infection. Immune system deficiency. People with a low immune system have a higher risk of developing cervical cancer. When a person is infected by a sexually transmitted disease such as HIV, their immune system is less able to fight off early cancer. Herpes. Women with genital herpes or chlamydia infection are more likely to develop cervical cancer. This may be due to the inflammation of the cervix associated with these infections. Smoking. Women who smoke are about twice as likely will be infected by cervical cancer compared to those who don't. Researchers believe that chemical substances in cigarettes can damage the DNA of cervix cells and may contribute to cervical cancer. Age. Becoming sexually active at an early age increases exposure to getting infected. However, people younger than 20 years old is said to rarely develop cervical cancer. But as their age increases, they remain at risk and must undergo screening test. Socioeconomic factors. Many low-income women do not have easy access to adequate healthcare services. Some of them avoid screening tests and vaccination considering HPV-related services are expensive in nearby private clinics. Oral contraceptives. Research suggests people who have used oral contraceptives for 5 or more years have a higher risk of getting cervical cancer than those who have never used them. The risk increases following the usage duration of contraceptives. Exposure to DES. It's a hormonal drug given to some women between 1938 and 1971 to prevent miscarriage. Women whose mothers took DES during pregnancy are at risk to develop clear cell adenocarcinoma. Hence Pap test is highly recommended for them. You have reached the end of the lesson. Thank you. The continuation of this lesson will be made available in Module 4. Don't forget to complete the quiz questions.